Everyone, we thought we'd be festive. Everybody loves our holiday tree and comments on it, so we thought we would do our Instagram live in front of our holiday tree. And somehow we amazingly matched the tree, which is amazing. But Santa's little helper gave us Sculptra, so we thought we would talk about that today. We have a long lineage with Sculptra, so I've actually been injecting it since 2006. Stephanie and I are actually conducting a study we can't talk about because it's top secret, but we've been involved in multiple studies here at Art of Skin related to this product. So we thought we'd talk about the background. There's a lot of social media sort of buzz about Sculptra. I certainly am a firm believer in the product. I've served on global advisory boards. I've published probably about 8 studies. We've been involved in about 9 of them. I've been a part of global consensus statements on the product, but maybe we can start with what it actually is.
Yes.
So what is Sculptra, Steph?
So Sculptra is a biostimulator, and it's made out of polylactic acid, which comes to us, it's like non-GMO corn and beef. That comes to us in a powder formulation, and we just mix a little numbing and some salt water in it, and it becomes a suspension, and we're able to inject that into areas where we want to stimulate new collagen, help with building collagen and elastin, helping restore volume loss in the face. So it's a beautiful treatment that's very slow and steady. It takes about 3 to 4 months to kind of see those results. So it's something very gradual over time. But I love it because it really helps with the skin envelope as well. So we see that glow back to the skin in addition to that volume restoration.
So we've been involved, like I mentioned, with multiple studies involving it. We were actually a part of the 5-year safety study, so post-approval in 2009 for the product. They do something called the safety study. So it was actually a 5-year study where I ended up injecting patients in the nasolabial folds, which is just a convention. It's not necessarily where we inject patients a lot these days. But looked at patients through that time period, and interestingly, a proportion of patients, even at 5 years, maintained some volume replacement after that. Other studies that we've been involved in, we were actually a part of. Now Sculptra can be immediately reconstituted, and we were a part of that study as well. So we added 5 cc's of sterile water for injection, agitated it for a minute, added 3 more cc's of sterile water, then added 1 cc of 2% lidocaine and injected that. Half of our patients received that, half of our patients received no numbing, and there's a big difference in actually admixing the lidocaine. I think we're big on patient comfort here, and admixing a little bit of lidocaine, which is now on label, and we know we can safely actually admix this. We used to be in advisory boards for years doing all sorts of things, like you need to warm the solution, you need to shake it, you need to be able to reconstitute it days or weeks in advance, and you can immediately reconstitute it and use it. I was just lecturing at the ASDS and doing part of the live injectable workshop actually on the body, where I was using Sculptra in the buttock region, and we immediately reconstituted it backstage, and I was injecting a model 30 minutes later. So proof to the pudding. I think that gives us some flexibility. We're a very large volume Sculptra injector, so we don't necessarily immediately reconstitute a lot, but it's nice to have that flexibility, isn't it?
Definitely.
What are some of your favorite areas to inject Sculptra?
I love doing this like pan-facially. So for example, temples where you see some hollowing as we age. Definitely the mid-face, so cheeks, buccal cheek area too, and to help with the little fine lines and wrinkles that we can get over time. Pre-auricular areas, the beautiful spot, Dr. Palm mentioned nasolabial fold. I do a dot there.
Yeah.
I think I do majority of it lateral face mostly, and cheeks, and I think patients really love the results that they're getting with it.
And there's 2 FDA-approved planes that we inject this. So we inject it immediately subdermal, so below the second layer of the skin, and then a plane called our supraperiosteal, which is right on top of bone. So either very deeply, and that helps with structure, or just more superficially, just below the dermis, which helps with that skin envelope, thickening the skin, and helping with skin quality. So in 2023 or 2024, the newest indication for Sculptra came through, and that's where some of my colleagues actually did this study and injected in this region on either side of the face once a month, up to 4 times, 1 vial per side of Sculptra, and we saw skin quality improvement. So it helped the skin texture. We can now talk about Sculptra, the glow, the skin radiance on label, and it actually helped with refinement of the jawline and sharpening that in the study. The most recent study that's been done is actually with GLP-1 patients. So 2 of my colleagues on the East Coast, Dr. Larang and Dr. Salmanek, took patients and they injected Sculptra in that same region, kind of lower half of the face, and then they either used Restylane Lift or Restylane Contour to help with cheek volume. And these patients had lost a substantial amount of weight. So they were about 1.67 years into their weight loss with the GLP-1s, and many of them had lost about 18 to 20% of their body weight. So a significant amount, and we see facial changes, don't we, when patients have been on GLP-1s. So what we found in that study was that patients needed multiple sessions with Sculptra to help with some of the volume loss in the lower half of the face. And when we combined that with selective use of fillers in the right areas, really patients saw a nice glow and had improvements with that. So I think that's a conversation piece that comes up in terms of Sculptra. Anything you're looking forward to? I know we had, our fall sort of summer skin rescue. Sculptra was one of the top things that patients purchased. We love them to do a series. I think it's a popular product in our practice because it gives gradual results, but meaningful results over time. What do you tell patients like maintenance looks like once they get through the initial series of
So once they finish their series, and it can vary based on how their decade of life, I usually tell patients come in every 6 to 9 months and just do like one. We can reassess just to keep things happy, and that way they don't have to do a whole series again. But definitely, we've got a lot of longevity with the product. So
yeah, so I think beautiful product. I was actually the only derm author on a paper with 7 of my facial plastics colleagues talking about surgical timing and some of the things that we do in aesthetic offices. So neuromodulators, things like collagen stimulators, fillers, energy-based technologies, lasers, and light treatments. And Sculptra, with all of us, these are 7 facial plastic surgeons and myself, consider this low risk. So if it's done in the right way, in the right planes, if you are considering facial plastic surgery, it really isn't impeding time, and there'll be a really interesting article coming out in the future where they're looking at operative time of patients that have had surgical procedures done, and does this vary? And it doesn't. So I think we've got more literature to support some of the things that are opined on social media with actual literature and sort of bodies of research and more opinions that are consensus-based rather than a single opinion. But if you've got questions about Sculptra, we're definitely a practice that I think is tried and true in terms of things. I've been injecting it 2 decades. Stephanie has a ton of experience as well, and involved in some of the bleeding edge active research in the field. So we would love to have the conversation with you with Sculptra. We're both Sculptra patients ourselves. So if you have a need for sort of more questions to be asked, certainly give us a ring. Our phone number is 858-792-7546, and our website is artofskinmd.com. And we're wishing you guys a happy holiday. All right. Bye, you guys.
Bye.